Please like, share, comment, and subscribe. Hello everyone, welcome back to our channel. Today we're talking about something very important for anyone on dialysis: heparin use during treatment. This video is based on evidence from medical research, so you can feel confident that the information is trustworthy. When you're on dialysis, your blood travels outside your body through a machine called the extracorporeal circuit. This circuit, made of plastic tubing and a special filter called a dialyzer, is essential for cleaning your blood. However, your body has a powerful natural defense system. When your blood encounters these artificial surfaces, it perceives them as foreign, triggering a clotting cascade. This process, known as contact activation, signals tiny blood cells called platelets to become sticky and clump together. Then, a protein called fibrin forms a mesh, trapping blood cells and creating a solid clot. If a clot grows large enough to block the circuit, your treatment is immediately interrupted. This means your blood isn't being cleaned, and the time you spend on the machine is less effective. Furthermore, the blood trapped in the clotted circuit is lost, and the entire set of tubing and the dialyzer must be discarded and replaced, causing significant delays. To prevent this, we use medications called anticoagulants. The most common one used in hemodialysis is heparin. It works by interfering with the clotting cascade, ensuring your blood flows smoothly and freely through the machine. This allows your treatment to proceed effectively and safely, giving you the full benefit of your time on dialysis. Heparin is used during hemodialysis to prevent the blood from clotting in the extracorporeal circuit dialyzer and tubing. This is typically achieved through a combination of an initial bolus dose and a subsequent maintenance infusion. Now you might wonder, how do doctors decide how much heparin to give me? It's a great question because the dose isn't a one-size-fits-all prescription. Instead, your clinical team acts like a detective, gathering clues about your specific situation to determine the perfect amount of heparin for you. This process is called individualizing the dose, and it's a critical part of safe and effective dialysis. The goal is to strike a delicate balance: enough heparin to prevent the circuit from clotting, but not so much that it increases your risk of bleeding. To achieve this, your team considers several key factors. First, your body size and weight. A larger person naturally has a greater blood volume. To achieve the same therapeutic effect, they will often require a higher dose of heparin compared to a smaller person. Next is the length of your dialysis session. A standard 4-hour treatment needs consistent anticoagulation from start to finish. Longer sessions mean the blood is outside your body for more time, so the dosing strategy must be adjusted to prevent clots from forming throughout the entire treatment. Your dialysis access type also plays a role. Catheters, for instance, can sometimes have a higher risk of clotting compared to a well-functioning fistula or a graft, which might influence the initial heparin dose. Your personal bleeding risk is paramount. If you have a history of bleeding issues, have had recent surgery, have liver disease which can affect clotting, or are taking other blood thinners like warfarin or antiplatelet drugs like aspirin, your team will be extra cautious. They might use a lower starting dose, a slower infusion rate, or stop the heparin earlier before your treatment ends. The specific dialysis machine and, importantly, the type of filter or membrane being used matters. Some materials are more likely to activate the clotting cascade than others, and your doctor will adjust the heparin dose accordingly to match the equipment. Finally, your team may use lab monitoring. By checking blood tests that measure clotting time, such as the ACT-activated clotting time or anti-Sa levels, they can get real-time feedback on how your body is responding. This data allows them to fine-tune your dose with incredible precision, ensuring your treatment is both safe and effective every single time. So, how does your care team decide on the right anticoagulation strategy for you? It's not a one-size-fits-all prescription. Instead, it's a careful, ongoing process of balancing the critical need to prevent clots in the dialysis circuit against the equally important need to avoid bleeding complications. This delicate balance is at the very heart of safe and effective hemodialysis care. Your team considers everything we've discussed: your medical history, the type of dialysis access you have, your lab results, and how you've responded to past treatments. This is where the principle of shared decision making comes into play. It's a partnership between you and your healthcare providers. This collaborative approach is guided by evidence-based practice. It means your team combines the best, most current scientific research, like the comprehensive 2020 review by Doctors Claudel, Miles, and Miria, with their clinical expertise and, crucially, with your personal health situation, values, and goals. By integrating all these elements, we can tailor a plan that is not only medically sound, but also right for you as an individual. This ensures you receive the safest, most personalized care possible, session after session. So, the next time you're on dialysis and the nurse gives you heparin, remember, it's there to protect your treatment and keep your blood flowing safely. The dose is carefully chosen based on your health, your treatment plan, and medical evidence. For patients at high bleeding risk, some sessions are done without anticoagulants, but clotting still occurs in about 5 to 10% of treatments. Mechanical approaches like higher blood flow rates, airless tubing, or intermittent saline flushes can help reduce clotting. However, these strategies often lower dialysis efficiency, add extra fluid, and require frequent dialyzer changes. In a prospective study, more than half of anticoagulant-free treatments ended early because of clotting, while nursing workload stayed high due to constant circuit monitoring. Your team weighs these trade-offs carefully to keep you safe. And remember, always talk to your dialysis team if you have questions about your medications. Thanks so much for watching. We hope this helped you understand why heparin is important during dialysis and how your care team decides the right dose for you. Please don't forget to like, share, comment, and subscribe for more videos that make dialysis care easier to understand. Your support helps us reach more patients and families.